All right, so we're into the next phase. So we're going to move towards induction. It's been about 15 minutes since we gave his IVs. He's feeling pretty good right now. Got a little pant going from one of the pre-anesthetic medications, but that's okay. I don't think he can really feel his face right now, which is okay. That's exactly where we want him to be. Kind of relaxed state, but his respirations are good, his gum color is good, and he's responsive if we stimulate him, so that's perfect. So the next stage is going to be what we call induction. We're going to use a specific medication to do that. It's a quick acting anesthetic, meaning it's rapidly metabolized and gets out of their system quickly. Really, this drug is just to get him to a level of anesthesia where I can pass the tracheal tube, endotracheal tube safely without him gagging or having any reflexes. So we're going to give that IV slowly, and he'll be up here when we do this. And then after we give the induction drug, we're going to immediately hook him up on gas anesthetic, and that's what we're going to use to maintain him throughout the dental procedure. After I push the induction drug, and you're going to see a lot of hands moving, a lot of motion. This is really where the team comes together, because as a doctor, we're getting the anesthesia situated, getting him at a level plane for care, and then as soon as I get him intubated, I'm going to move out of the way and let the techs kind of get him hooked up on our anesthetic monitors. We've got several things going on. There's a lot of stuff going on right here that you can see. We've got an anesthetic monitor that will check his temperature actively, so we can see those temperature falls real time if there is a fall. We may not have one. We're going to check his blood pressure, which is this machine here. We'll do that every 2 minutes, and we monitor that over time, so if there's a trend in falling, we can catch that early. We also check ECG to monitor if he gets too deep. We can catch some abnormal rhythms in his heart rate and heart rhythm. If we see some electrical problems, if he's too deep, that can cause that problem, so that's an indication that we need to change some things up. He's going to be on a warming blanket. That's what this thing is, just to keep his body temperature from leaching out and cooling too quickly. He's going to be on some IV fluids just to support him cardiovascularly and help metabolize those drugs quickly and support his blood pressure while we're moving through. And then we're also going to be checking his oxygen levels with what's called a pulse oximetry. That looks at how well he's breathing that oxygen and saturating his blood with that oxygen. So if his respiratory rate starts to fall, sometimes we'll see that oxygen level fall, or maybe there's a problem with the tubes or with him getting the delivery system, and sometimes the delivery system itself, and where he's not getting oxygen, and that's why we always monitor the oxygen levels here. I believe that's it, and then we've got a technician. If we see any abnormals with the machines, any abnormal readings, we always check the patient to make sure those things are real before intervening, whether changing our anesthetic levels with the gas decreasing, or giving supportive medications, upping fluid rates, all that stuff. So we always want to make sure those things are real before we change the plan, because you can really you cause him to wake up, and then you got that problem, and then you have to give more drugs. So we're careful to monitor. Monitoring is what I think elevates us here from other services around. So yeah, so at this point we're going to move him to the table. We're going to start induction.